Good afternoon. Thank you for joining the Community Partners webinar today. My name is Erica Johnson, and I am Medicaid's Chief of Staff. Before we begin, just 3 quick housekeeping items. First, closed caption is available for the webinar in both English and Spanish. To view those captions, click on that gear icon that's located at the bottom right-hand corner of your screen. Choose the caption/subtitles option in your preferred language. Second, a copy of today's slide deck and the recording will be available on the website tomorrow, and all of the web links that are referenced in the presentation will be accessible within the deck. Third, please use that Q&A feature to ask your questions and to provide comments, and we'll try to answer as many questions as possible at the end of the webinar. Okay, just a quick reminder before we begin. The purpose of the Community Partners webinar is to keep you informed of what's happening in North Carolina Medicaid and to provide you with information that you can share with Medicaid beneficiaries and the stakeholders. The target audience is beneficiaries, county agencies, and local community partners. While Medicaid providers may find the information shared today very helpful, there are other resources designed for provider information. We'll have a provider resources slide at the end of the slide deck. And we'll go on to our agenda because we do have a full agenda of information for you today. Today, we'll have a discussion. We'll have an update on Medicaid expansion, a discussion on Hurricane Helene flexibilities, co-pays. We'll have non-emergency medical transportation. We'll talk about the MAC/BAC, which is the Medicaid Advisory Committee and the Beneficiary Advisory Council, tailored care management. We'll have resources for you, and we'll have time for Q&A. All right, well, let's go ahead and get started. Please welcome the Deputy Secretary of Medicaid, Jay Ludlam.
Thank you very much, Erica. Good afternoon, everyone. I hope you are well and had a relaxing Thanksgiving holiday. I am looking forward to the holidays coming up and spending some time with my family. So I'm looking forward to that. All right, let's move to the next slide. So just to reintroduce myself, I am Jay Ludlam, Deputy Secretary for North Carolina Medicaid, and I am really pleased to just share with you today a little bit about, I'm going to talk about Medicaid expansion. I'm also going to go off script and talk briefly about the Children and Family Specialty Health Plan and maybe try to preempt some potential questions around the transition, the administration transition, both locally here in North Carolina as well as at the federal level. So first of all, we are incredibly excited to celebrate with you the 1-year anniversary of Medicaid expansion here in North Carolina. It has been an amazing year after 10 years of working really hard to be able to open up access for over 600,000 individuals who might be eligible for the expansion program. I believe we had on December 1st or thereabouts about 591,000 individuals who have successfully participated in the program or currently enrolled in the program, which is an amazing accomplishment. And Governor Cooper yesterday at ECU in Greenville was able to celebrate with providers and with those individuals who are benefiting from expansion, as well as with some staff from DHHS and other departments across North Carolina. So really important, incredible work. A lot of prescriptions that have been delivered. Really, those prescriptions address chronic diseases, often address chronic diseases. We've seen dental care. We've seen hundreds of millions of dollars in expenditures with hospital systems. who, of course, help fund the Medicaid expansion program. 90% of that program is funded by the federal government, and 10% is funded through an assessment of our hospital systems. So very appreciative of that opportunity. That means no general funds, no North Carolina taxpayer dollars are being used to provide access to health for those 591,000 individuals and families. In addition to Medicaid expansion, we are still doing recertifications, and those are in progress. Want to remind individuals that you should be responsive to your local DSS offices if they're asking for more information. Take a moment to update your contact information if you've moved or if you have a new phone. We definitely want to make sure that we're able to reach you and provide you with those important notifications that are critical for you to be able to maintain your access to health, as well as just remain alert and aware of any changes to the program that you might be able to benefit from, or you may want to make adjustments to your healthcare because of. So definitely be responsive to your local DSS offices and get them the information they need so that they can process or reprocess your application or recertification. One internal note, I think, but it's really a celebration, I hope, for all of us, and that is that earlier in November, the Department of Health and Human Services, North Carolina Medicaid, was given and recognized, given an award and recognized for the work that we did together as a state in our work towards expansion. And in particular, this award, which was given out by the National Association of Medicaid Directors, bet you didn't even know we had such an association, but this is all 56 of the Medicaid programs across the country and in the territories of the U.S. Recognized us for our work in the continuous coverage unwinding and the way we launched expansion. In particular, it was the way we worked with community partners to develop toolkits that were customizable in both different languages, as well as reinforcing core key messages, but allowing communities to adjust those messages to meet the needs of that particular community. We were also recognized, in addition to that, for our Medicaid Ambassador Program, where individuals across North Carolina can help get their neighbors, their community members, family members enrolled in Medicaid expansion. So kudos to you all. Congratulations to the DHHS team for the recognition. But best of all, again, I keep going back to that 591,000 individuals who would not have had Medicaid and access to health but for Medicaid expansion. Switching topics really lightly, but trying to be quick. The Children and Family Specialty Health Plan. The Children and Family Specialty Health Plan was supposed to launch on December 1st. This health plan is a comprehensive health plan to support individuals, foster youth, former foster youth, and soon their families in getting access to specialized services and healthcare. This would incorporate, physical health, behavioral health, access to pharmacies, in addition to our Healthy Opportunity Program, where that is. So really excited to be able to award that late summer. We've been working with our health plan partner, Blue Cross Blue Shield of North Carolina, in adjusting the project timeline. Originally, we were supposed to launch 4 or 5 days ago on December 1st. We have obviously not launched. We are working with them to define and decide on a new date, and we'll be announcing that in the new year, very early in the new year. I just want to emphasize how our work here at the department, the work we do with our partners and our vendors, is to work very closely with them to understand what it is and what it will take to be successful. Success is how are we taking care of our members, those individuals who are participating in the program. If we are not ready, we will not go live. when we are ready, we will absolutely go live. But we'll be announcing that date in the new year. Very committed to the program and believe it's going to offer, again, a really important innovation to support families and youth across North Carolina. The third, and I won't spend too much time here, is around the transition. So first, there's a transition that's happening here at DHHS and all across the executive branch and probably other political subdivisions like the Treasurer's Office and the Department of Insurance. But there are these transitions that are happening as new leaders come in because of term limits. And so Governor Cooper will be leaving office in the new year, and Governor-elect Stein will be coming in. We have begun the process of educating the transition team about what it is we do here at Medicaid, what it is we do here at the department, and working very closely with them to understand how they should absorb the work and get ready to go as soon as it's handed off to them. So that work is well underway. There's also a lot of conversation about what is happening at the federal level. And I think that what I will say there is a lot of conversations, a lot of news stories that are coming out. Currently, though, President Biden is still president. His cabinet is still operating and running the government. There will be a new president in January, and we will, of course, work with the new administration come January. We have worked with this administration in the past. In fact, we negotiated the Healthy Opportunities pilot program under the previous administration. So that work will continue, and we will continue to advance the needs that we all have towards making sure that individuals have access to the care that they need, that the providers and families that support them are similarly supported, and that we're really focused on healthcare outcomes and how we're improving health for the people of North Carolina. So I appreciate the extra moment or two, Melanie, but I'm going to hand it off now to you. Thank you.
All right. Thank you. I am not on camera. Excuse me. Next slide, please. So we have implemented a number of flexibilities for Hurricane Helene. CMS, our Centers for Medicaid and Medicare Services partners, allow us to implement flexibilities when there are natural disasters or during the public health emergency during COVID, for example, that help it make it easier for folks to receive services in case they have to evacuate, in case they can't get to providers. We were granted flexibilities on October 1st. They were effective from September 26th, which was the day of the arrival of Hurricane Helene, through December 25th of this year. These are all outlined in great detail on our website. But we wanted you all to be aware that you can have temporary expedited enrollment for healthcare providers. Applicants or authorized reps can apply wherever they are, even if they've been evacuated. Recertifications have been paused in affected counties, and they were restarted. They were paused in October and restarted again in November. And there have been a pause on change in circumstance until folks could get situated after the arrival of Hurricane Helene. Next slide. Wanted to also make sure that folks are aware that our copay in Medicaid is limited actually by federal law. The North Carolina General Assembly sets the amount, but federal law does require that it be very low. Medicaid is available to everyone without premiums, without deductibles, and there are certain services that are do require a copay, but there are many populations that are exempt from copayment altogether. For the services that we do have copays, doctor's visits, non-emergency transportation, optometrist and optical visits, outpatient and podiatrist visits, and chiropractic visits. and then generic brand prescriptions are $4 per prescription. I will say that there are certain individuals like children that are not subject to copay, pregnant women, members of federally recognized tribes. All of this information is also available on our website. And then wanted you all to be aware of our non-emergency medical transportation program. Individuals are, if you are unable to have transportation, personal transportation to medical appointment, it is a covered benefit under the Medicaid program. There are a couple of different ways to coordinate it depending on what health plan or Medicaid program you are in. But we wanted to walk through sort of the key differences. It is covered regardless. If you are in Medicaid, it is a covered benefit. You should ask for your ride at least 2 days before your appointment so we can make sure that it's scheduled. Urgent pickups, you do not have to ask ahead of time if you have to go to the hospital or pick up a pharmacy prescription. The numbers should be listed on your health plan. If you are in Medicaid Direct or the Eastern Band of Cherokee Indians tribal option, call your Department of Social Services to coordinate your transportation. If you're not sure which health plan to call, you can contact our enrollment broker. Our health plans, our standard plans, and our tailored plans work with their own NEMT brokers, and that information should be available on your card, and you would call that appropriate number. If you drive yourself to an appointment, or if a family member drives you, you can get money and reimbursed for gas and travel time. So you need to contact your health plan or your county Department of Social Services for that information. Slide. I will turn it over to Kathy, our communications manager. Kathy?
Thank you. Next slide. All right. I am here to share a new program that is coming to Medicaid. It is our new Medicaid Advisory Committee and Beneficiary Advisory Council. And the intent of these new programs is to get input to improve NC Medicaid. Next slide. In April 2024, the Centers for Medicare and Medicaid Services released the final rule that they called Ensuring Access to Medicaid Services. And under this new rule, they require every state Medicaid agency to create a Beneficiary Advisory Council, which we're referring to as the BAC, and a Medicaid Advisory Committee, which we refer to as the MAC, by July 2025. The MAC-BAC is designed to center the lived experience of beneficiaries, their families, and caregivers, and provide a more formalized structure for beneficiaries and interest parties to provide feedback to the state about Medicaid. The MAC will replace the current Medical Care Advisory Committee that advises Medicaid on health and medical care services. The MCAC has been in existence for around 40 years, and the meeting tomorrow will be their last meeting as we implement the MAC and the BAC. Next slide. The reason for the MAC-BAC is to, like I say, provide insights to Medicaid on topics related to program operation and the needs of Medicaid beneficiaries, including coordination of care, eligibility, enrollment, and services, beneficiary and provider communications, access to services, cultural competency, language access, and health disparity, quality of services, and other items that we might feel are appropriate to review. Next slide. So the MAC. The MAC will be a diverse group of Medicaid stakeholders that have a wide range of perspectives and experiences. The MAC will include BAC members and at least one representative from each of the following categories: clinical providers or administrators, participating health plans or state associations, other state agencies as ex officio members, state, local, and community-based organizations. Next slide. The MAC will be composed of at least 20 members, with members selected from the 14 congressional districts, along with 6 additional at-large members. We will phase in a portion of BAC members to the MAC, and this will be done on a staggered basis. So effective July 2025, 10% of the membership must be BAC members. Then the following year, 20%, with the final percentage, 25% in 2027. BAC members can rotate on the MAC to alleviate the burden of serving on the MAC for BAC members, because that will put them as serving on 2 committees. Next slide. The BAC. The BAC is something very unique. The BAC is a beneficiary advisory council, and it will be a dedicated forum for people who have lived experience with Medicaid. The membership must include current and/or former Medicaid beneficiaries, family members of beneficiaries, and paid or unpaid caregivers of beneficiaries. The BAC will be composed of no more than 18 members, with, again, members selected from the 14 congressional districts and 4 additional at-large members. Next slide. The MAC and the BAC can be built to meet the unique features of the program. We are required by this July to have bylaws and a recruitment facilitation process in place that will include member selection criteria. Members must be selected on a continuous and rotating basis. We will be required to do onboarding or education, set term lengths. Members can serve non-consecutive terms, but they cannot serve consecutive terms. So in other words, if they're on for 3 years, they would have to step away and then be added back. Members, how we have members roll on and off, and whether or not we choose to look at compensation for members. We can take existing committees and adapt them to meet the requirements of the BAC and the MAC, as long as the committees meet the new requirements. And we note this in publicly posted bylaws that the group is being used to fulfill the BAC and the MAC regulatory requirements. So some of our current MCAC members who have just joined within the last 6 months have agreed to move over to the MAC. Next slide. The meeting frequently, we are required to have both the MAC and the BAC meet once each quarter. They can hold additional meetings as needed. The BAC is required to meet separately from and before the MAC to ensure BAC members are prepared to participate in the MAC meeting. We have to offer rotating participation options, including in-person, all virtual, hybrid, which is virtual, and in-person attendance. Regardless of the meeting format, we must always have a telephone dial-in option available to members. 2 of the MAC meetings each year must be open to the public with dedicated time for public comment. The BAC will decide for itself which meetings, if any, are open to the public. CMS granted the BAC a lot of leniency to determine their structure in order to build trust and let the participants have a feeling of being able to share their input without fear of retribution. Next slide. The selection process for the MAC-BAC must be open to the public. The members will be selected by our Deputy Secretary of Medicaid, and interested parties must submit applications. In the application, the prospective members must describe their interest in the Medicaid program, and we are required to ensure we have varied representation on the BAC and the MAC. For example, enrollees with different demographics or healthcare needs, provider types, etc. And where we are in the process is we have developed our application. It is now posted on our website, and we are actively taking applications for both the MAC and the BAC. We will take applications through the end of the year. Then applications will be reviewed and members will be selected. Next slide. There are different ways to apply for the MAC. You can go to our website, which is listed on this slide, and fill out an online application. You can fill out a paper application that you can download from the website, or if you would like help in filling out your application, just email medicaid.ncengagement@dhhs.nc.gov, and we will be glad to assist you with your application. Next slide. I did want to just share, we have our website up. It has a lot of detailed information on the MAC-BAC. It has the applications, and as of today, we have a toolkit for our community partners that would like to assist in sharing our message. It has social media posts that you can download, flyers, email content, etc. So as Jay mentioned earlier, that was one of the things that we found very successful was CCU unwinding and Medicaid expansion, and we're hoping that it will do the same with the MAC-BAC. Thank you. And I believe my next person is Gwen.
Good afternoon. I am Gwen Sherrod. I'm one of the Tailored Care Management Program Managers, and I want to talk today about Tailored Care Management. Next slide. So before I start to talk about Tailored Care Management, I want to talk about the difference between a tailored plan and Tailored Care Management. We get a lot of questions about that. Folks seem to be confused. So I want to start out talking about tailored plans. So what is a tailored plan? Tailored plans are a new kind of North Carolina Medicaid managed health plan. They cover your mental health, severe substance use, IDD, TBI, and prescriptions all in one plan. If you get North Carolina Medicaid direct services for these needs, your NC Medicaid plan may have moved to a tailored plan. The name is changing, but the services are not. Tailored plans include services for people with more intense needs, including people with serious mental illness, severe substance use disorders, intellectual and developmental disabilities, and traumatic brain injuries. And to learn more about that, you can look at on our website, medicaid.nc.gov/tailored plans. Next slide. And just a little bit more, who runs the tailored plans? Tailored plans in North Carolina are managed by 4 companies called local management entities, or LMEs. They will cover your behavioral health, physical health, and prescriptions. If your NC Medicaid moved to a tailored plan, it will be managed by one of these 4 companies: Alliance Health, Partners Health Management, Trillium Health Resources, and Via Total Care. Next slide. And how will I know which tailored plan I'm in? A letter was mailed out mid-April. That letter had information about which tailored plan you're in. and your plan is assigned based on the county where you get your Medicaid benefits. There is only one tailored plan per county, and your assigned tailored plan is based on the county that manages your Medicaid benefits. You cannot choose a different tailored plan. You cannot live in one county and choose a different tailored plan. And so here we have a map that shows the counties covered by each plan. Next slide. So I want to move into talking about tailored care management, and just wanted to give a little bit of a milestone. December 1st was our 2-year anniversary on the launch of tailored care management. The tailored plan launch was July 1 of 2024. So it's been 2 full years that we have been providing tailored care management. So Tailored Care Management, or TCM, is a free service. It's a service from North Carolina Medicaid. Tailored Care Management pairs you with an expert who helps, who knows the healthcare system, commonly called a Tailored Care Manager. It's for people who have serious mental illness, severe substance use disorder, an intellectual developmental disability, or a traumatic brain injury. Next slide. So how does it work? One, it's part of your Medicaid benefits. Tailored Care Management is a service available for tailored plan members and some beneficiaries with NC Medicaid Direct. Also, it's free and it's optional. Tailored Care Management is free. It's your choice to use it. You can also cancel at any time. And 3, it's personalized help. Your Tailored Care Manager works with you to help you navigate the healthcare system and manage your difficult medical issues. They can even help with basic needs like food and transportation. Eligibility. You may be eligible for Tailored Care Management. This service is available for tailored plan members and some beneficiaries with NC Medicaid Direct. Your health plan ID card should have one of these companies, and we talked about that previously: Alliance, Partners, Trillium, or Via Health. People with North Carolina Medicaid and these conditions also qualify for Tailored Care Management services. And so if you have some type of mental illness, such as schizophrenia, bipolar disorder, and/or depression, an addiction to alcohol or drugs, such as opioids or cocaine, intellectual or developmental disabilities, such as Down syndrome, autism, and fetal alcohol syndrome, suffer from a traumatic brain injury, such as from car accidents, falls, and sports injuries. Other programs are also eligible for Tailored Care Management. Are dual eligible members, means that you have some members are eligible, means you have both Medicare and Medicaid. NC Innovations Waiver recipients, traumatic brain injury waiver recipients, and waitlisted members receiving Medicaid. Having Tailored Care Management will not affect your place in line. So who's not eligible? Certain services are like Tailored Care Management. If you already get a similar service, you may not be able to get Tailored Care Management at the same time. Your Medicaid health plan can tell you if you're receiving similar services. Call your Medicaid health plan and ask if you're eligible for Tailored Care Management services, which are available for tailored plan members and some beneficiaries with NC Medicaid Direct. People with these Medicaid health plans are not eligible for Tailored Care Management. If you are in the standard plan, meaning your health plan is AmeriHealth, Caritas, Carolina Complete Health, Healthy Blue, United Healthcare Community Plan, or WellCare, or if you are receiving health services through the Eastern Band of Cherokee Indians, ECBI Tribal Option. So let's talk about Tailored Care Managers. Tailored Care Managers are trained professionals who know the system and can support your health and well-being. They partner with you to develop a care plan to help you achieve your goals. They can even help with basic needs like helping you get food and help you arrange for transportation. Tailored care managers organize services for physical health, behavioral health, intellectual and developmental disabilities, or IDD, pharmacy, long-term services and supports, and traumatic brain injury. Tailored care managers may work through an Advanced Medical Home Plus, or AMH Plus, Care Management Agency, or CMA, or provided through the LME MCOs and tailored plans. Individuals eligible for tailored care management are intended to have a single care manager. So how can your tailored care manager help you? Tailored care managers help you get the care you need. They help you manage your health and well-being so you don't have to do it all yourself. So they can help you arrange doctors and specialists, help you with housing resources, help you find food and nutrition issues, help you coordinate rides to appointments, support with chronic conditions like diabetes, help you find support groups and community activities, help you manage your prescriptions and medical supplies, help you during hospital admissions, transfers, and discharges, and be that direct contact for all things Medicaid. So they give you, tailored care managers give you personalized help. So for those that have intellectual or developmental disabilities, they can help with community-based supports, help coordinate independent living, respite care, school or job supports, building your care team, and supported decision-making. For those with addiction recovery, they can help with finding treatment programs, support groups, sober living supports, therapists, help after treatment, and job coaching. For those with traumatic brain injuries, they can help you find brain injury specialists, rehabilitation programs, TBI support groups, independent living, school supports, and job coaching. For better mental health, they can help find support groups, therapists and psychiatrists, prescriptions, and help during a crisis, and job coaching. Tailored care managers can also help manage chronic medical conditions like diabetes or hypertension. So how does the beneficiary find their tailored care management agency? If you're eligible to receive tailored care management, a TCM provider will be assigned to you. A letter was mailed to you with the name of your, or will be mailed to you with the name of your TCM provider. You may get a phone call or other communication from your TCM provider. For more information, you can call your Medicaid health plan, and we have the numbers here for Alliance Health, Partners Health Management, Trillium Health Resources, and Via Health or Via Total Care. If you're not sure which plan you have, call to find your Medicaid plan, call the number listed here. You can visit our website to learn more. Answers to frequently asked questions are available on our website, medicaid.nc.gov/tailored care management. So tailored care management, care managers can help you achieve your goals. So if you're eligible, you'll be matched with a tailored care manager based on your needs. You can call your tailored plan or Medicaid Direct and ask, who is my tailored care manager? And they can provide you with their contact information. If you want to change your tailored care manager, you can do this twice per year for any reason, or to change more than 2 times per year, you need an approved reason. For example, if your provider moves to a different location, you call your tailored plan or your NC Medicaid Direct plan, and they will help you find a match based on your age, location, and health issues. So one of the last slide that I have is around consent for tailored care management. And I just want to stress that for folks that are wanting to take advantage of tailored care management, that you have to consent for the service. So a member's assigned care manager must ask for the member's consent for participating in tailored care management. As a part of the consent process, the care manager must explain the tailored care management program. Care managers will document in the care management data system that the member provided consent, including the date of consent. And so to end this is my last slide. We have a lot of information on tailored care management. We have developed a toolkit, which is available on our tailored care management webpage that has a lot more information about tailored care management. Next slide. So I think I'm turning this back over to Melanie.
Thanks, Gwen. Great job. I think that I am going to be walking through some resources. Can we go to the next? Oh, the ambassador. Sorry, I get ahead of myself. So we created the Medicaid Ambassador Program to help folks learn more about Medicaid expansion and to help walk through folks in their applications for Medicaid. This is not something that a lot of people have done before. We understand it could be a little confusing. And so we've created this Medicaid Ambassador Program that has representation statewide to help assist individuals, not taking their private information, nothing like that, but helping them understand how to apply for Medicaid and helping them walk through the application. Medicaid ambassadors do receive training. They walk through a Medicaid online application. They understand some tips and tricks that you may need to help fill out the application. And they have attended a demo so they understand what a beneficiary may be or an applicant may be seeing when they apply. They have to have established confidentiality agreement with your organization and attest that you meet all the requirements. We have organizations across the state that have volunteered to become Medicaid ambassadors. We really think that it's important for Medicaid beneficiaries or applicants to hear from trusted voices in their communities. And so we really appreciate everyone who has already signed up. If you would like to become a Medicaid ambassador, you can email us. If your organization is willing to talk to the folks that you work with, let them know more about Medicaid expansion and help them walk through the Medicaid application, please get in touch with us. We really appreciate it. Next slide. We do have resources. ePass is our online Medicaid application. You can apply for Medicaid there. You can also apply for food and nutrition services and temporary assistance for needy families. For the Medicaid portion, we do have fact sheets about the Medicaid application. You can also watch a video in English or in Spanish. Our website is available and you can also apply at your local DSS. You can call your local DSS. You can apply via paper or fax, or you can go in person and they will take your application. Next slide. We also want you all to know Medicaid is a really complex program. We do our best to get resources out on our webpage for folks to be able to understand more. We want you to be aware that a lot of this information is available online. Our Medicaid website includes specific playbooks on managed care and expansion for our counties and for our providers. We also have a help center that you can type in a question and hopefully pull up an answer from our knowledge articles that we placed on the help center. We also send out bulletins on a weekly basis, more or less, to our provider community about changes in the Medicaid program. And then we have a Medicaid webinar series, our Back Porch Chat series. This is usually done on a monthly basis. It is hosted by Medicaid and AHAC. We have moved these used to be after hours. We have moved them to the lunch hour so that more folks can attend. And we do have a website that you can register for or view our previous webinars. Everything is recorded and posted online. And so we want you to be aware of these provider resources. Next slide. All right, we do have our slide deck and recording that will be available on our website. And if you do have other questions, please feel free to send them to us. But I will be looking now to the chat to see what we have in the queue. And we have also got a couple of questions that have already been submitted. All right, I will start with the chat. I think this is, I'm going to call on representatives from our member team. I believe Sandy Danner is on. What is the typical turnaround time for a Medicaid application?
Hello, this is Sandy. The typical turnaround time, it can take up to 45 days, but if all information is submitted when the application is sent in, it could definitely be more timely. So the maximum should be 45 days for a application. And if you are disabled, and there's a lot of other things that can go along with it, but 45 days.
Thanks, Sandy. I think the next question I'm going to throw to you, Jay. As we make the transition into the new governorship and the new federal administration, what are going to be the priorities for the Medicaid program in the next couple of years? What can folks prepare to see coming out of the North Carolina Medicaid?
Yeah, I appreciate the question. Thinking about how are we going to talk to the new governor, the new legislature about what it is we've accomplished, what it is we've built over the last 8 years, and where we're headed. I think that the new governor, the governor-elect, will come in with an agenda of what he and his team want to accomplish. Similarly, I am very confident the North Carolina General Assembly will come in with their own priorities, and we'll want to work with both to, again, use the foundation we've built, use the investments we've made over the last number of years, and try to build from strength, build from that. Our focus will remain very much the focus it currently is, which is members and the providers and families that support them. So the individuals who are on Medicaid and the providers and families that support them are going to remain our focus. We are in, I think it's year 4 or about to go into year 4 of our managed care program. We have healthy opportunities. We have tailored care management. We have these tools, tailored plans. We have these tools that we've been building, and we want to use them and allow them to be effective with improving the health of North Carolinians. So at this point, I don't want to speculate too hard, but I think it's going to largely be building from our current foundation and strengths, and just remain focused on the individuals in Medicaid and the families and providers that support them.
Thanks, Jay. We have another question that's been submitted, and you touched on it briefly, and I just want to give you the opportunity to expand. The question was, will there be programs to develop, will there be programs to help those with Medicaid with rent, food, and utility assistance? And so I wanted to provide you the opportunity to talk a little bit about our Healthy Opportunities program.
Yeah, I was going to say that sounds a little like our Healthy Opportunities program. I believe people are aware that our Healthy Opportunities pilot is operating only in 33 counties, only in the managed care delivery system here in North Carolina. And in part, it provides, utility supports, it provides access to food, transportation that wouldn't normally be available with non-emergency transportation under the CORE program. And it provides a number of other wraparound services for victims of interpersonal violence and domestic violence. And so with it being only in 33 counties, we have actually seen and have been able to document using data to show that this program improves health and arguably or it can be demonstrated to reduce costs or save money for care. And so our intent is to bring this program statewide. We have been negotiating with our regulator, CMS, for the last year around expanding the Healthy Opportunity Program to be a statewide program to be able to serve more members. That will require money and it will require investments over time. So while we anticipate getting that waiver approved before the end of the Biden administration, we will need to take steps working with the General Assembly over the next couple of weeks and months to help them understand what this authority we have gotten and where we can apply it. And then we'll need to work with our community partners to write an RFP, a request for proposal, to award that, to begin making investments into those community-based organizations and network leads all across North Carolina to support the work. So there is more to be done, but we do feel a great sense of urgency because we see the real value of this program in supporting and reducing the costs of Medicaid.
Thanks, Jay.
Yep.
There's a slew of eligibility questions, Sandy Danner, so get ready. But before I jump into that, there is a question here about behavioral health services and how they're delivered in standard plan, in tailored plan, and in Medicaid Direct. The standard plans do provide behavioral health services. It's more limited benefit than what is provided by the tailored plans and by the LME MCOs and Medicaid Direct, but there are behavioral health services in our standard plans. Our tailored plans do provide a more rich benefit for behavioral health services, substance use disorder, and services for folks with intellectual and developmental disabilities. If an individual is not in a standard plan or a tailored plan, they have not been moved to managed care yet. They are exempt from managed care. They're in our Medicaid Direct program, and they will continue to receive their behavioral health services from the LME MCOs as part of Medicaid Direct and as part of some limited benefits as part of the Eastern Band of Cherokee's tribal option. So I just wanted to quickly answer that question. Okay, so Sandy, where shall I start? We've got a couple of questions about QMB beneficiaries and who pays the co-pays and co-insurance on that. And I'm not sure if you can answer it or we can take it back, but I've seen a couple of questions on that. I'm not sure I have Sandy anymore. QMB beneficiaries are people who are dually eligible for Medicare and Medicaid. Medicaid does cover co-payments and co-insurance for certain Medicare dually eligible individuals. I don't know specifically, so we're going to put a pin in that and come back to that in just a minute. Just making sure I've got Sandy on the line. What is the processing time for a client switching from a standard plan to Medicaid Direct or a tailored plan? Is there any way to know the client is receiving or plans to receive enhanced services on the Medicaid application? Go ahead,
Can you hear me, Melanie?
Yes, now I can. Yep.
Sorry, I couldn't get my sound to work. Can you give me the first question again?
Sure. So what's the processing time for a client switching from standard plan to Medicaid Direct or a tailored plan?
So from standard plan to Medicaid Direct, we don't really, at this time, going from standard plan to Medicaid Direct normally takes, what you would do is you would contact the enrollment broker, contact our enrollment broker and request that change. That's normally a change. It will be effective the following month. So any changes that you want as far as your standard plan are concerned, there's also some additional guidance around moving to a tailored plan. When you want to move from a standard plan to a tailored plan, you can complete a form called a request to move to tailored plan, and that decision is normally made within 3 days and is normally effective the first of the following month. So it is a fairly quick process.
I do want to just point out that if you have a need for a service that is not provided in a standard plan, your provider can submit a request to move form for that service, and it should be approved within 24 hours. I also want to say, and Sandy touched on this a little bit, we don't really have the option to move to Medicaid Direct unless you are an exempt population, or you become a member of an exempt population. And so those exempt populations include our dually eligible individuals, our foster care children right now, members of federally recognized tribes, etc. Otherwise, you're going to either stay in your standard plan or your tailored plan. So I just wanted to let you know. But if there is an urgent need for a service that is not available in a standard plan, it can be processed if the provider submits that request within 24 hours. Okay. Let's see what else we have. I think this was touched on earlier, I think when Gwen was talking, but someone submitted a question: can a person who has one tailored plan switch to another tailored plan? The answer to that question is, our tailored plans and our LME MCOs are geographically based. They are defined by the county in which you live. If there is, for any reason, some reason they cannot meet your healthcare needs with the providers that they have, that can be escalated through the enrollment broker, but generally your options are limited by the county in which you reside. Sandy, there's a question about attachments and ePass. Do you want to explain to folks how you can, what you need to do in order to be able to submit attachments and in terms of like an enhanced account?
Absolutely. In order to be able to complete that enhanced account, you have to, there is a place on the website to request. There's an email address that actually allows you to request an enhanced account. And when you submit that, it is going to allow you permission to submit those attachments. So having your account enhanced and getting those additional privileges will allow you to have to be able to attach those documents. And that is just a simple email address. Normally someone will get back with you within 24 hours, normally a lot quicker than 24 hours, in order to verify your information. They just basically need to verify who you are and to verify your NCID information, and you can have that account enhanced and be verified for it.
Thank you, Sandy. We do have a follow-up question on moving. Is there a way to note whether a client is receiving or plans to receive enhanced services on the Medicaid application? Unfortunately, there's not a way to notate that. So if we do not have an existing clinical history with this beneficiary, then we will automatically default that individual into a standard plan. If there is a request for a service that is not available in a standard plan, then we would go through that request to move process. Or if we determine that the services that that individual is using in a standard plan may qualify them for a tailored plan, then they would move to a tailored plan. So I hope that answers the question. I've seen it a couple of times. Okay. Looking at some more questions. I know we have a number of them, but I just want to do a time check on where we are. This will be the last questions. This is for you, Kathleen. How did the results from any back MAC meetings move into the decision-making process? Can you talk about that?
Yeah, thank you. As I said, we are still in the process of defining everything, but we will be actively involved with administration, and input that is provided by the MAC and the BAC will be shared with administration and vice versa. As we've done with the MCAC, we have had a strong rapport between the committee members and the administrative team, and we hope to see that continue with the MAC and the BAC.
All right, thanks. All right, that concludes our question and answer. I will turn it back over to Erica.
Thank you so much, Melanie. Thank you again so much for your questions. Thank you for your comments. Thank you for your participation today. As a reminder, a copy of today's slide deck and the recording will be available on our website tomorrow. Thank you so much. Have a wonderful evening.